Dr. Noni Macdonald.
I'm going to start by saying it's 1 o'clock in the morning for me in Halifax, and I am really tired, folks. So I may not be as articulate as I would like to be. First of all, I want to say I'm incredibly honored to receive this because this is your peers saying you've done a good job. And many of the other awards that you get, you sort of go, yeah, I don't know, maybe they were a bit political or you knew somebody. It's not what this one's about. This is a recognition for all the hard work that all my other cohort for this year's induction have said. And you know from the other lists that came up, this is an incredible group of people, and I am deeply honored to be amongst them. The second thing, that was Joni Mitchell, 1970, big yellow taxi. She was a woman ahead of her time, a role model for many of us at that time. She never gave up. She brought environmental issues to the fore in 1970, and we are still paving over and making those parking lots when we need to be doing so much more in environmental science and in climate change. I gave a talk a week ago to a vaccine course in Europe for people from all over the world, looking at climate change and where we were going to go with vaccines, but particularly looking at the footprint of what vaccines cost in terms of CO2 emissions with their production, with their transport, with their putting out to clinics globally around the world, and what we could do to decrease the medical waste from vaccines. Well, I challenge every single person in this room to think about your office, the hospital you work in, the department you're in. I see Ian Boehmer there at the Royal College, and others. What can we all individually do to decrease the health and healthcare CO2 emission carbon output? Because all of us have to own this, or my kids and my grandkids, and eventually I hope great-grandkids, are going to be in deep, deep mess. And it's time we got on to doing this. And my second challenge, and anybody who knows me would know I would have to say something on this. We all have two jobs to do as healthcare professionals. Number one is to do our job really, really, really well. But the second one is because we need very much to look at the problems that we see all around us when we're doing our job and not just ignore them or say it's somebody else's problem, but get down there and figure out what needs to be done to solve them. Every single person needs to be doing their own research on these kinds of problems that we run into. And that's where micro-research, it's not about microbiology, it's small programs, small amounts of money. The micro-research program that Bob Bortolucci and I started more than 15 years ago has shown us how much the community, when you give them the power and the skills, can help solve problems that improve the health outcomes in the communities, whether those are in sub-Saharan Africa or those are here in Canada. One quick short example, we did a micro-research program at Memorial University at the Marine Institute. In one of the teams that was made up of a couple of fishers, a sea captain, some Coast Guard folks, and some grad students, their research question was, how do fishers want to get their mental health care? How many of you know that fishers have a higher job-related mortality than police or firemen? And do you know at the time they started to do this research project, there was zero work on the mental health of fishers? And that's what I mean by each of us need to be thinking about what are the questions we're not asking and that need to be asked and answered. Thank you very much.